Ever since the dawn of the modern hospice movement in 1967, it has faced challenges. It's as true now as it was then. The challenge to maintain financial stability in times of economic uncertainty. The challenge to ensure anyone who needs hospice care is able to access it. The challenge to spread our expertise beyond our traditional boundaries. The challenge to consistently maintain that the end-of-life care we offer to patients is as good as what we would want for our own families. Just keeping up with the daily pressures in modern hospice makes it difficult to find time to consider new ways of delivering our service. But continuing the way we are is not really an option when we know demographically that we are facing huge numbers of new patients in the years that lie ahead. Could changing our work patterns help us improve and expand end-of-life care across a wider population? Can we consider different ways of delivering our services while maintaining the quality of care for which we're so highly valued by our communities? One of the ways that Hospice UK would like to encourage such thinking is through the use of Project ECHO.
Project ECHO is a performance optimizer. Think of it as a high-speed internet connection for the healthcare system. It spreads new medical knowledge throughout the healthcare system, from university medical centres and other specialty care sites to the front lines of community care. Rather than information flowing in one direction, community providers learn from specialists. They learn from each other, and specialists learn from community providers as new best practices emerge. Under ECHO, community providers use video technology to participate in guided practice with specialist mentors. They acquire new skills that allow them to treat patients they otherwise would have referred out. Patients with complex chronic conditions get high-quality care where they live from providers they know. No waiting months to see a specialist. No long drives back and forth to get critical care. ECHO exponentially increases access to specialty care by moving knowledge instead of moving patients. Suffering and pain are reduced, and lives are improved and even saved. Project ECHO, changing the world fast.
Project ECHO was developed in New Mexico in the United States to meet the needs of an underserved population for specialist input and support using online tele-mentoring and through building up communities of practice.
We use technology like video conferencing.
End of treatment viral load and 6 month post.
We started with hepatitis C, and then we realized that patients with substance abuse disorders were not getting good health care in rural New Mexico because there were no experts in that area. We had experts in Albuquerque, so we said we would echo them. One thing led to another. After that, we started a diabetes program. Now we have ECHO projects in 19 separate areas.
ECHO, which stands for Extension of Community Healthcare Outcomes, is based on 4 key themes. It involves a community of those freely willing to look together at new ways of working, to see if by new working we could be more effective at reaching those in need with high quality care.
There's obviously a dramatic deterioration between June 2015 and November 2015. And we all see this from time to time and just have great difficulty understanding what is happening.
Yeah.
Was there anything in his lifestyle change or anything like that that could explain such a dramatic change in his HbA1c?
It's difficult to be certain. In my head, it had been that his lifestyle had slipped, but I honestly, like yourself, am perplexed. I do believe he's telling me the truth. I don't think his lifestyle is drastically any worse, and I think it is just something to do with the diabetes.
ECHO works by developing a community of practice involving the key partners in delivering quality care, including generalists and specialists. Clinical ECHOs provide the support and peer encouragement to help such a community work to their full potential in a safe, supportive and governanced environment. ECHO networks exchange both the latest evidence-based understandings about disease processes or symptom control, as well as specialist knowledge about individual patients and their communities. An integrated community of practice in which a disease specialist works together with a patient specialist will be able to deliver better quality care than either could deliver in isolation.
During the sessions, I'm able to make suggestions and ask questions or clarifications, even if it's not my own case. It's a giant mind center of collaboration.
Dr. Bankus, would you consider compression stockings, thinking that this could be an element of post-phlebotic syndrome?
Well stated, Madhu. What do you think, Naomi?
Oh, she doesn't have edema per se, but
It is best practices all over the state to these sites. And mind you, these providers are really talking like they're rheumatologists. They know all the lingo, they know all the therapies, and it's very gratifying.
At the same time, the underlying Echo technology software will allow hospices to gain access to other specialist input in new service models extending beyond the clinical. Echo also focuses on telementoring. Telementoring provides isolated practitioners with the practical knowledge and support to help them look after more patients in their own situation. And through case-based discussions, learn from peers and specialists in a very focused and practical manner to help deliver more complex care closer to the patient. Project Echo also offers a unique opportunity for sharing knowledge to many different staff groups in our hospices, clinical and non-clinical. By sharing and working together, we can build networks to support each aspect of our hospice work. Hospice UK is committed to the use of Echo methodology to ensure that over the next 5 years we take full advantage of the opportunities that it provides for us to explore ways of working which better fit the needs of our populations in our local hospice areas. Our initial plan is to help establish and evaluate Project Echo in each one of the 14 regions across the UK, from where we will all have the opportunity to see it in action and hopefully see new service models. We hope it will allow the hospice movement the opportunity to showcase new ways of working for our NHS colleagues as well, and move us forward in our vision to secure consistent, high-quality, end-of-life care right across the country. The hospice movement began by pioneering new ways of providing end-of-life care to patients. With Project Echo, maybe the hospice movement can again spearhead new ways of working which better meet the needs not just of our patients, but of generations of patients to come, both in hospices and right across the NHS. Let's hope so.